Hello and welcome to another episode of Today's Medicine. I'm Dr. Hugo Pellegrinolo, and today I'm going to be talking about the TV show House MD. As always, thank you very much for watching today's episode, and don't forget to like and subscribe to the channel. And as always, we do have English, Spanish, Portuguese, French, and Ukrainian subtitles. In this episode of Today's Medicine, I'll be analyzing the episode of House MD, in which a jazz player was misdiagnosed with ALS. The episode starts with the jazz playing an instrument, and the patient has a reaction that leads to pneumonia. Patient is on a protocol for paralysis of his leg. He has ALS or Lou Gehrig's disease, a nervous system syndrome that weakens muscle and impacts physical function. In this disease, nerve cells break down, which reduces functional ability in the muscles that they supply. The cause is still unknown. House does not believe the disease to be ALS and wants to try another different diagnosis. The patient now does not know which is the actual diagnosis, since Dr. House already planted the seed saying it could be any other disease. In this moment, the patient asks for a DNR, asking for no other medical treatment to be done. Dr. House says to Dr. Foreman that a DNR only means do not resuscitate the patient. The patient now has crashed, and Dr. House breaks the DNR since he does not believe the patient has ALS, and begins a code and intubates the patient. Now Dr. Foreman and Dr. House are fighting since the patient was intubated by Dr. Gregory House. Now Dr. Gregory House is spitballing differential diagnosis with his other doctors, is still not believing that the patient has ALS. Now Dr. House believes the patient has Wegener's granulomatosis, which is an autoimmune disease, and asks for an autoimmune panel. Since the patient is going to argue in court that he should be allowed to die, they go to battle the DNR in a courtroom. Now Dr. Gregory House is trying to gain more time to convince and find the proper diagnosis that is not ALS. Now trying to kiss ass on the judge, Dr. House makes an argument that the judge on the issue to be on his side, and he eventually agrees with Dr. Gregory House. Now Dr. Gregory House is using a medication called Cytoxan for what he believes to be Wegener's granulomatosis. Now the patient and Dr. Foreman have agreed that the patient does not have Wegener granulomatosis, and they are gonna pull the plug on the patient and let him die. For some reason, after the plug's pulled from the patient, he's still breathing, going against the ALS diagnosis. And since the patient is still breathing, Dr. House makes another mistake by wrongfully assuming that the patient has Wegener's granulomatosis. Now Dr. Gregory House is back to step one, since both diagnoses were not correct. And now, when Dr. Gregory House is finally able to examine the patient, he still does not know what the patient has. Now Dr. Gregory House is thinking that the underlying problem with the patient is hypothyroidism. Now the patient is telling Dr. Gregory House that he finds him a complete workaholic, since he has absolutely nothing apart from medicine in his life. So an MRI is forced on the patient against his will. Now Dr. Gregory House is trying to actually figure out what the patient has. After having the MRI done, the medical team figures out that the patient had was a blood clot in his brain that led to paralysis of his arm. And now Gregory's team is trying to push the patient to have an embolism of the brain so that he can regain control of his arm. And apparently after the embolectomy, the patient is feeling his leg again, meaning that he did not have ALS. And Gregory House now wants to stop all medications to actually figure out what is wrong with the patient. After removing all the medications from the patient's getting worse, and they need to figure out what is actually happening with him. Now Gregory House, alongside with his team, are trying to figure out once again what is the underlying problem with the patient, since they are still in the blind, meaning they have no idea at all what the patient has, so they decide to do another MRI on the patient. Finally, with a diagnosis of arterial venous malformation, they are capable of figuring out what the patient has. But here comes my question to all of you. Do you think doctors should treat patients like Gregory House does, insulting and degrading them, as well as his colleagues? Or do you believe doctors should have better bedside manners when treating patients? As always, thank you very much for watching today's episode. If you have any doubts at all, you can always send me an email to hugo.loh@gmail.com. Thank you very much for watching. Don't forget to like and subscribe to the channel.